We have the expert for that who could help us break it down. We have Dr. Florence and Manurung, an ophthalmologist from Jakarta Eye Center, Menteng and Kedoya. She is going to explain about lazy eye from the symptoms, the causes, and how we could possibly treat it. So,
Perfect.
Dr. Flo, good morning. How are you?
Morning, Doc.
Hi, good morning.
It's good to have you.
I'm fine.
It's good to have you. So, straight away into this whole lazy eye syndrome. What is it exactly?
Okay, so amblyopia, we call it amblyopia or lazy eye, is an early childhood eye condition where children have good or perfect vision in one eye and reduced vision in the other eye. It happens due to abnormal vision experience early in life that changes the nerve pathways between retina, a thin layer of tissue at the back of the eye here, and the brain. When this happens, the brain suppresses or ignores input from the weaker eye, and then brain starts to rely on the better eye, and in doing so ignores the weaker one. If left untreated, the brain may begin completely ignoring any images it gets from the weaker eye in the long run, which may have a permanent impact on the child's vision. So amblyopia is actually a leading cause of vision loss in both kids and adults, and the single most preventable disabling condition among children. So more than 1 in 50 children are at risk for amblyopia.
Wow.
Yes, and the prevalence is ranging between 0.2% to 6.2%.
Okay, that is alarming to me that it's actually the leading cause because we don't hear about it enough. I mean, I've heard about it before.
Yes.
Now, is this something that's visible, Doc? Because the name is lazy eye. Obviously, to me, I look at it as like an overcompensation. Like if you have one strong leg, you tend to overcompensate on one side than the other. And it seems to me that's what this is. But is it something that's visible? Because with young children, they may not have the ability to convey how they feel or how their vision is. So can we see it as parents by looking at their eyes? Is there perhaps one that is off that perhaps can be a sign, an indicator that they may have amblyopia?
Yes, good questions. Amblyopia should be detected early, and intervention may lead to full recovery actually. So sometimes lazy eye is not evident without an eye exam. And unfortunately, amblyopia cannot be detected easily by parents. Why? Because most children suffering from lazy eyes will not complain of any vision problems, as you just mentioned. In a lot of children, the brain and the better eye make vision in one eye so well that the child does not even notice that they have an eye problem. In other cases, the child may get accustomed to having good vision in only one eye. Parents also find it hard to spot amblyopia in children who have well-aligned eyes.
So, just a follow-up question straight away then. What are the symptoms that should alarm us to go straight to an ophthalmologist to get it checked?
Yes. So, amblyopia can be caused by some conditions, which I will explain here. Typically, eyes that are amblyopic have some form of refractive error. What is that? It is such as astigmatism. It is an uneven surface curve of the eye, hyperopia or farsightedness, so the child can see better in near, and in distance, and myopia, nearsightedness, the child can see better in near. A significant difference between the prescription in each eye can result in lazy eye, which we call refractive amblyopia. So one eye has a -3 and the other eye has -8. That can cause lazy eye on the worst eye, on -8. So, however, parents should not take note amblyopia only caused by that condition, but also other eye conditions that obstruct the child's vision, such as droopy eyelids and childhood cataracts, which we call debrevation amblyopia. Strabismus or squinting can also result in amblyopia, which we call strabismus amblyopia, because the child's eyes are misaligned and don't look in the same direction. So just like this, okay?
So these are the ones that are physically visible.
Yes, that one.
Okay, so Doc, what are the causes of this? Is this a genetic thing, or is it because kids are using gadgets more these days than our era when we were kids, or what are some of the reasons this is happening?
So there are some degree of hereditary in developing lazy eyes in children, but so that is important to get children checked as early as possible. So usually also in premature birth, on small size at birth, and developmental disabilities like what we call that children who was born with a brain problem, that should be checked earlier.
So they're at higher risk, is that what you're trying to say?
Yes.
So we've done some reading, and Paul and I were talking about this. And there are, and you've also mentioned that this particular syndrome is treatable, or you can go through therapy for this. How can you treat lazy eye? Are there certain exercises that you can do to, train and help the brain not to compensate on or rely only on one eye?
Yes. So the important thing is that an eye doctor will conduct an eye exam. So you need an eye doctor here. So checking for the eye health of the child. So he or she will see a wandering eye or a difference in vision between the eyes or poor vision in both eyes. Then eye drops will be given to dilate the pupil, so the doctor will also see the retina, so the layer inside the eye. And then it is important to start treatment for lazy eye as soon as possible in childhood, when the complicated connection between the eye and the brain are still forming. The best results occur when treatment starts before age 4 to 5 years of old. So although half of children between ages of 7 and 17 respond to treatment, but the sooner the better. Treatment options depend on the cause of lazy eye and how much the condition is affecting the child's vision. So the principle is the lazy eye must be forced to be used. Usually this is achieved by eye patches like this, where the good eye is covered for a certain number of hours during the day. So the child has no other choice but to use the worst eye. Then eye patches usually have to be worn for weeks or even months at a time, depending on the child and the condition of the eye. And if there's a refractive error like glasses, minus, plus, or synodal, so this will be prescribed while patching will be done. And if there's cataract or a droopy eyelid, that needs urgent treatment to prevent permanent vision loss. And this is quite or more severe type of amblyopia. And for most children with lazy eye, proper treatment improves vision within weeks to months. So from 6 months to 2 years.
Okay, so I guess I'm getting that early detection is key, and that it's the earlier you catch it, the easier it is to treat, and the more likely they can heal from this. Now, on the opposite end of the spectrum, like a lot of other illnesses, if gone untreated, can have negative consequences. Now, permanent eye damage, that's very alarming to me, Doc. How is it that that can happen? Does it get worse over time if left undetected, or is it because due to age?
Okay, so even though visual impairments from amblyopia begins in childhood, it can continue into adulthood if left untreated. So can it worsen? Yes, it can, especially in children. So that's why a regular checkup is very important.
My question would be, what happens if you never noticed it as a child, it was never diagnosed as a child, and you only find out as an adult? So what happens to the adults that have, that only just learned of their amblyopia in their adulthood? Is there the same kind of therapy that can be done? Or do they use specialized glasses? what can be done for the adults who
if I can add to what Kai is saying as well, because if I'm getting this correctly, the symptoms would just be you might have blurry vision, or you might not even notice it at all, except one day you decide maybe I need glasses, and you mentioned that sometimes people come in to get their eyes checked to get glasses, and apparently glasses don't help. So yeah, that situation as well.
What happens to the adults who are being diagnosed so late?
Right.
Yes, yes. So one disadvantage of having lazy eye, if not untreated, is lack of stereoscopy or loss of depth perception, 3D vision, which we call.
Right.
Yeah. So yes, as you just mentioned that mostly of adults didn't know that before, and when they get for checkup, then they realize, and the doctor told them that you have an amblyopia, lazy eye. Can it be still treated? So there are some research written that yes, we can try if before there's no treatment done before, but the prognosis is not as good as it is treated when we are in the childhood. So we can just try and tell the adults. But it is better if you have lazy eye before and you didn't know that. So do the checkup earlier in your child. So the sooner the better.
Yeah, the best way is just prevention and early detection. So you mentioned getting a checkup. How often do we need to go to an ophthalmologist, Doc?
Yes. So in children with parents who has a problem like refractive error glasses, or they have some other condition, eye condition, a child should be checked like 6 months to 1 year of age. And if there's no problem in their family, eye problem, so a child can be already checked in in age of 2 or 3 years. And then every year should be checked, except there's a problem on their eyes, it should be checked like 3 to 4 months.
Okay. So even if we have no problems whatsoever, you still need to get your eyes checked just in case. You never know, right?
No, but amblyopia, can it be detected as early as 0 to 2 years old?
Yes, of course. So if you have a baby, so it's like 4 to 6 months of age, and you see there's a wandering eye, a squint, it should be checked very early. So just bring your child to the doctor, and they will search the cause of the squint, and maybe a mother can see that their baby's eyes are white. So, and this could be cataract. So we should done early treatment on that. If not, the brain will not work perfect.
Right. Yeah, no, that's a good point, because we never think about taking a baby or a toddler to an eye doctor, but then again, they cannot communicate to us exactly what they're seeing, if what they're seeing is perhaps blurred. I was talking with my wife the other day, how do we even know that our kid's not colorblind until they start identifying colors to us, right? Yeah, this is something that's definitely of concern.
So it's good to know. So the first checkup of a child, if the parents don't have any problems, should be at least at 2 to 3 years old, before 5, right? That's for sure. Interesting, Doctor.
Yes.
Thank you so much for this morning. This is interesting.
Thank you.
Really appreciate the insight into amblyopia, and hope that our viewers are able to get a lot of insight out of this as well. Take good care, Doc.
Take care.
Thank you.
Hope to see you soon.
Bye.
No pun intended.